Hello, dear friends. I wanted to come and give you some information on back pain, knee pain, groin pain, and there's a group of muscles that sometimes get shortened from sitting so much. So if your job requires you to sit a lot, um, sometimes standing a lot can impact these muscles, but I want to give you some information on the anatomy and then some ways that you can alleviate some pain. So yoga is going to help you if you're a practitioner already, it's going to help you anyway. But these muscles work so hard in everyone that some people don't realize it. Most people have pain inside the hips. So it would be, here's my hip bones, and this is the iliac crest right here, filled in with viscera and muscles. We won't mention adipose tissue, but this can get painful. It can go down into the groin, and some people have back pain when it's not really from your back. It may hurt there, but that's not where the problem is. So I wanted to show you the psoas group of muscles. I have this chart here from bandayoga.com, and it's just phenomenal to show, to illustrate the anatomy here, and I can kind of explain what happens. So you have the top of your femur, which is your thigh bone, way around and underneath. So this group of muscles join and they attach there. Then they come up inside the femur, up through the groin, up inside of your iliac crest, your hip bones here, and then they come around and they attach to the spine. So you can see right here where they're attached to the spine. So you have the iliopsoas group. This is the main the main psoas muscle. So you have a major one and a minor one, and they all come together. And then this is the iliacus here. So the muscle lays on the inside of your iliac crest. I don't know if you can see this here, but here's the crest, and the muscle comes all the way up to the edge. It kind of fans out. So those get sore. Now those you can palpate and you can massage that if it's tight or painful. If you lay on your stomach, um, like on the bed where it's a little bit soft, you might feel some pain in here. So most people don't realize they even have pain in there. So you can kind of go in with your thumb and massage it. You can even feel it refer back to your iliac crest, your hip bone back here. Okay. So this group of muscles are what initiate lifting your leg. So when you lift your leg, and it's only a short period of time that it lifts your leg. So the stretch that we're going to do doesn't take a lot of work. So I'm going to show you how that is. So I want to show you another picture. This is a diagram of a person in warrior one pose. So you can kind of see how these muscles lay together and work. So this is the bent knee in front. This is the back leg stretched out with the heel up. And here's your psoas group. Here's the spine, and the muscles attach at the spine, and then they come down. There's the psoas major, the psoas minor, and then the iliacus. So I was working in home healthcare for a while. I still do, but I was working a lot of hours with a patient who was coming to the end of his life. So I was sitting with him for hours in the day, up to 6 hours, 8 hours, just holding his hand to comfort him. It was during COVID. He did not have COVID, but it was during the early stages of knowing about the health crisis that came upon us. So his family couldn't come and see him, and I was kind of it because I was his caregiver. And he was in a nursing home recovering from breaking his hip. So in all that sitting, my groin became so tight and sore because I've been doing yoga for 50 years, okay? And I'm used to movement and dance and yoga and walking and hiking. So to sit for all those hours for an extended period of time, these muscles shortened and tightened. And I didn't have issues in my back from it, but I did in the groin. And it became very sore. And it took me 6 months to get that stretched out again to where I can do the splits, stretch in the wide angle stretch. So it can be very painful. And I wanted to show you a little, if I can get this a little bit more close up. This is the iliacus here. It extends up and just lines the inside of your iliac crest. So those you can reach and massage. These other ones, you might have to go to a massage therapist that specializes in the abdomen and those parts of the body. But you can see here how the iliacus comes down and wraps around the femur. It comes around to the back. So you can have challenges all along this area, but a lot of people think they have back problems when it's really your psoas. So I'm going to show you a couple of exercises that will lengthen those again and stretch them. Exercise certainly helps. If you can get exercise every day, yoga, yoga stretches, walking, just keeping active and keep moving. So I'm going to show you, let me move this out of the way here. So there are two that I've learned over the years that are really helpful. And if you're not able to get down onto the floor, there's no worry. I'm going to show you a way that you can pull it off in a chair, hopefully. So first we'll do it on the floor and I'll show you. Now I have done these in my classes that are in the recorded versions of my yoga classes. You know, those are classes that I've actually taught live and I've just recorded them and loaded them up onto YouTube. So we do this periodically in class, so you may have seen this before if you've been watching the videos, but I wanted to give a specific little lesson on this so that I can put it in the the videos where you can find that easily in the playlist. Okay, so that's what I'm going to do. I'm going to put it in the playlist. So you come down onto your back. Let me move this out of the way for now. Come down onto your back, one knee bent, let's say the left leg, and stretch out the right leg. Bring your hands underneath your hips just to support your low back. So your left foot is flat on the floor, knee vertical. The right leg is extended. Flex the right heel out, flex the foot. Rotate the leg out to the right from the hip, so the toes are out to the side, and then slide your heel over 3 or 4 inches and hold that rotation outward, and then just lift that leg up, but only as high as the bent knee. So you're not going to go, this is not a stretch for the back of the leg. This is a stretch for the psoas, and it's a release. It's called a psoas release. So the leg only comes up to the top of the bent knee, and you can repeat this 8 or 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you just repeat on the other side. So bend your right knee, foot flat on the floor, extend the left leg out, flex your foot, rotate that leg out so the toes are pointing outwards to the left. Slide the heel over 3 or 4 inches, and then start your leg lifts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's all there is to it. Now, if it's difficult for you to get down onto the floor and you want to do this exercise, get in a chair that does not have arms on it, hopefully. So not an upholstered chair. I'm going to put this sideways. Sit in the chair, bring your hands onto the seat and move your hips as far forward as you can. You can lean back against the seat, the back of the chair. Keep your left knee bent here. Stretch out your right leg, rotate it outwards, and then slide it over 3 or 4 inches to the right. And then just lift maybe slightly above the bent knee so that you get more of a lift. Now this is also going to use your abdominal muscles, your low abs. So I think it's harder in the chair, but if you can't get down on the floor or if it's just too difficult to get back up, you can do it this way and just take your time. Maybe start out with 3 or 4 and build up. Okay, so other side, stretching out the left leg, flex the foot, rotate it out from the hip, slide it over 3 or 4 inches, and then lift 2, 3, 4. Because like I said earlier, these muscles are what lift your leg. When you take a step forward, that's what lifts your leg. So it's not engaged the whole time, but these muscles work really hard with all the walking we do. If you're into sports or yoga or whatever, it might become sore in there, and you can feel it if you go in. Um, but you can also massage it in there if you palpate and just go in. All right. Now, the other exercise that I want to show you, we don't do this one too often because it requires a bolster or a firm cushion, and people don't always have those. So this is just a regular yoga bolster. It's nothing fancy, but you come down onto it, you sit on it, and bring your hips like your tailbone to the edge of that bolster, and then lie down on it. Now, you want your tailbone just slightly off of it. And this is a simple stretch. And I'll show you for those who cannot or find it difficult to get down onto the floor, I'll show you an alternate way as well. So just stretch your right leg out, flex the foot. Now you're not going to be turning this leg out. It just remains straight. Bring the left knee in, overlap your palms. My teachers have over the years recommended that you do not cross your fingers because those fingers are attached to the back and it can cause undue tension in the back. So if you can, just overlap your palms. You have your right heel pressing away, and you might already feel a stretch in these psoas muscles. So we're going to work with the breath here. Take in a deep breath, a yoga breath. Exhale and pull that left knee in towards your chest as you press through the right heel. So that leg is active, it's working. Take in another breath. Exhale, pull the knee in. Another breath. Exhale and pull it in as close as you can. Meanwhile, keep pressing through the heel on that right leg. That's where you're getting the psoas release. And then just hold the stretch and breathe some deep yoga breaths, relaxing. Relax that area. And then just gently release and switch legs. So stretch out the left, flex the foot, and bring the right knee in. Overlap your palms. Press through the heel on the left. Take in your breath. Exhale. Draw the knee in. You always stretch on the exhale. I'd say 99% of the time. Take in another breath, deep breath. Exhale through your nose. Draw the knee in. Just keep pulling in. Sometimes you can move side to side a little bit to loosen it up a little more. I like to bring my head up to my knee just to get a little extra stretch. And then release. Okay. Now, for For our friends that have a little more challenge getting up and down on the floor, you can do this on the bed. And if I can use the chair as a prop here. So you would sit on the bed, come to the edge so that your tailbone, and you're just above the tailbone, and you can lie all the way back on the bed. Let's see if I can do that on the chair here. So the chair represents the bed. You lie all the way back. Stretch out the right leg. You'll feel an immediate stretch. Oh, it's wonderful. And then the left leg comes in. Overlap your palms. Take in your breath. Exhale, stretch the bent knee in. And you have a nice stretch, a nice draw on those psoas muscles. Okay. And then you just switch to the other side. Breathe in, stretch in, breathe out through your nose. Okay. So that's all there is to it. It's wonderful. It really releases tension in there, and that's going to release tension in your back. Now, let's go into Virabhadrasana 1, Warrior 1, for a moment. There is another way to stretch the psoas that people that have been practicing yoga can do, and I'll show you that in a minute. So just come to the front end of your yoga mat. We'll just keep our hands on our hips while we're focusing on the psoas and our legs, our placement, our alignment. Okay, so take in your deep breath. Just soften your knees and take your left leg back. I'll mirror you. Okay. So you can do some vinyasa moves to loosen up a little bit more. Press through the back heel, hip bones point forward. Picture your iliacus in there and your psoas. Breathe it in. Exhale out. Whoops. Exhale out. Lift in your ribs and your chest. So your psoas is getting a stretch here, and it's getting a workout on this side. Okay. So just step it in, soften your knees, breathe and exhale. Take your right leg back into Warrior 1. And you'll feel that stretch all along the psoas. So this is where it gets shortened when we sit a lot, causing tension, and then also the muscles will tighten all the way up into the spine. So people think they have back problems when it's really your psoas. And just bring it back in. So the other one that I wanted to show you, those that have been doing your yoga, just come into your downward facing dog. I hope my headset stays on. Just walk your hands out. Come into your down dog.
All right, so just inhale your right leg up into three-legged dog. Reach it up. Bend your knee and lift that knee up towards the ceiling. And then open the hip. Shoulders remain forward. Lift that hip up. Keep lifting the leg. And then you can bring it back down or go on to other poses from there. You can flip your dog and bring that foot down behind you if you want. Other leg, left leg, bring it up. Reach, stretch it up. Bend your knee. Lift the knee up to the ceiling and then rotate in the hips. It's a little twist. It's a wonderful stretch, a yummy stretch here. And then bring it back. And then come back up, however you want to come up out of it. All right. So that's your lesson on your psoas. See, is there anything else that I wanted to share with you? Oh, this can also go down into your knees and cause problems into the knees. Anytime you have issues in the hips or the back, it can travel down into the knees because you have your sartorius muscle that goes down the inside of your leg. Is it shown on here? Yes, it is. So your sartorius muscle is a long one. See this one that comes down to the knee and comes all the way up into the hip. So if that gets tight as well, people get knee problems, and you can prevent knee problems, pain or degeneration in the bones there, by maintaining your your psoas and sartorius health through the practice of yoga. It works. I used to jog. I'd run for a couple hours. I'd do like 15 miles. I majored in phys ed, and I loved exercise, and I still do. But there were times when my knees would just feel like it was bone on bone. Well, it wasn't, but it was my low back that was out of alignment. So that goes down and causes problems in the knees. So I just went to a really good chiropractor and got realigned, and now I rarely go because yoga keeps me in alignment. So, all right. I hope you enjoyed your lesson on the psoas. If you have questions, you can contact me through my website, michellestaryoga.com. If you want other information, anything that you have questions on, you can contact me. If you want a tarot reading, those are a lot of fun. And I work with numerology a little bit too. So I can give you your soul path numbers and what that means, what you're working on in this lifetime, your purpose and all that, and also the prosperity planner. So please do contact me. And I'm going to give you another video here shortly. So namaste, everybody.